One thing that I can't stop thinking about is the inevitable shortage of physicians in the U.S. coming in the next 5 years. What do you think?
Talk about inevitable. It's like, I just read a paper the other day, and you know what's scary is like, especially the behavioral health sector is probably going to get hit even more. And especially those low funded, which, you know, in the US, they're trying to protect those, and where reimbursements become higher for like your primary care, your family physicians. But a lot of those people are leaving that sector too. There's two people that are causing problems. It's your private equity firms and your insurance companies. So there's like Optum Healthcare, not just Optum, but Cigna, like all of them are trying to take over all these physician groups. And then the private equity groups are coming in and buying these physician groups and just combining everyone. And, you know, like a lot of these groups are run by one or two people, and they don't give a crap about anyone else on the team. And it's
about the shareholders' return.
Yeah. And it's, you know, when I built my practice, I planned on, because I trained in a big group, and like, I wanted to build a big group. My thing was I wanted everyone to be on their own and to be successful on their own. I was like, no matter what, I'm going to be successful because I'm going to work hard at it. And these people, I'll just bring them along. If they want to work hard, they'll be successful. Even if I did private equity, which is never going to happen, would I sell out like everyone else, you know, like these dermatology firms that, you know, like there's two people that rack in like $100 or $150 million selling the practice. And then they leave all their associates, which is like 20 physicians and like 10 nurse practitioners or something.
For multiple years.
Oh yeah, they're signed on for multiple years. And then all of a sudden private equity is like, oh, we're not making that much money. You got to take a pay cut. Like now someone else is in control. And guess what? Those higher ups in that group, they just got to sit on the board for a couple of years while everyone else has to like cut corners to treat patients in private equity terms or in like the insurance terms to be able to.
I think the simplest way to think of it like is it's you got another middleman.
Yeah.
Like, okay, I'm going to make sure this works for you. I'm an additional layer to like extract some type of value. And it's already like the most expensive care in the world. So
yeah, the population's growing and physicians are, no matter how many people go into medical school, there's still not enough training programs. And if more physicians leave medicine, you're going to have even less physicians teaching physicians. How are you going to make up that ground?
It's the anti-growth.
You know, so what happens? So like in Arizona, it's kind of crazy, but they start to put, you know, your CRNA who has 2 years of schooling to do your anesthesia. Are you going to let a CRNA do your major surgery or even like half a surgery?
Not without supervision. Not without supervision.
Sometimes you do have good CRNAs. They've been doing it for 20 years, but you can't give them the right of way to control the case when they just come out of school. They're coming out with like the certain amount of hours they need to have. And that's turned over. NPs already had the rights because they did extra schooling and everything to be able to, but their role is more as a primary care, and it's not in the surgical aspect. So they're not operating on you, but still, it's not the same schooling as your physician.
So that like comes back to like something I've been thinking about, because if you're going to have a physician shortage, the first place it shows up is like primary care, right?
Yeah.
That's why
and primary care is your local, your regular physician, and sometimes even your psychologist. Is it psychiatrist or
psychiatrist?
Sorry, I don't know.
Behavioral therapist. So yeah, like your primary care physician and like the shortage of it. And we started off this discussion with like AI, because AI, NPs, PAs, CRNAs, physicians, extenders, these are all ways to get more out of one physician than you can get, right? People argue that like, okay, we can make up for that with increasing mid-levels, which I agree with technology like AI. There's a good subset of patients or people that'll just go to Google before they'll go to a primary care physician to find out what their diagnosis is. So at least it's good to know that like it's getting better. So if you're going to diagnose yourself, at least you're getting closer.